taking the time after a long conference to come here with us today. And I hope everybody had their coffee so you're raring to go and ready to participate in an active discussion. My job today is quite easy. They've given me what I'm supposed to say right here, so all I have to do is read. And then there is a presentation that I'll quickly go through, and not to worry, I'd introduce the presentation, so it will be seamless and I'll have a lot of good information in there. And then we'll have the discussion. It's being taped, so no bad words. I know you all wouldn't do that. It's not happy hour yet, so we're safe. Okay, so the background, as you all know, this year's conference, the theme is winning the war against chronic non-communicable diseases, which includes diabetes, obesity, cancer, respiratory disease, cardiovascular disease, and mental health. The organizers have surveyed stakeholders in the community, such as service groups, private and public sector, medical community, educators, non-for-profit, and NGOs, to obtain feedback about what programs are in the Cayman Islands in relation to CNCDs, where there are opportunities or gaps, and whether the community is aware of such support. I will first present a summary, as I mentioned, of these findings to kickstart the discussions. These findings will form the baseline of the topics to be discussed during the workshop sessions. Each room has a panel of experts, and you can see their names there, but very shortly I'll just go over who these gentlemen and ladies actually are. I want it to be an organic discussion where we as a community can talk to each other, ask questions, and share ideas about how we can be healthy and conquer CNCDs. Although there are many experts in the audience today, I want to take the opportunity to introduce Dr. Earl Robinson. If you can't see in the back, raise it. There we go. Consultant pediatrician, Cayman Islands Health Authority. Miss Susie Bodden, educational psychologist, executive leader, Special Needs Foundation, Cayman. Susie, did you raise your hand? All right. And we have Dr. Robert Seawis. Yes? I got it? Yeah. All right. So I get a star. Neonatal pediatric surgery and adolescent surgery, Tenet, Florida, Physician Services. We have Mr. Michael Miles, Program Coordinator and Liaison Officer at Risk Youth. Ms. Jennifer McCarthy, Operations Manager, Cayman Hospice Care and parent of type 1 diabetic child. And Ms. Anna K. Price, Public Health Nurse, Child and Travel Health Clinics. So I'm going to briefly go through the presentations, and then we should have about an hour and a half to 2 hours, depending on how the dialogue goes and how eager you all are to get out of here. And it's going to be taped, and afterwards there's going to be a montage of the tape, the most important ideas that will actually be put online and sent to everybody as well. And they're going to hope to take the discussion today to help to form policy in the future. We'll be sharing opinions, so please keep in mind to be respectful and courteous to everyone in the room today. This is meant to be a session to share ideas and learn from each other in order to help us to lead a healthy lifestyle. And that being said, I actually looked at this PowerPoint presentation last night and realized that it was quite extensive, so I know that you all are dying to get to the discussion, so I will go through this quickly. What are CNCDs? You all would have heard about this today, but just to remind everybody, these are diseases that cannot be transferred from person to person, so diabetes, cardiovascular disease, mental health, respiratory disease, cancer, and obesity. Why we're here today, discuss what local organizations can do to help prevent and or manage CNCDs in Cayman, determine gaps that may be present, such as lack of funding, support from government, misunderstanding about local initiatives and or CNDCs themselves, and we want to share our knowledge and experience with others. Questions asked to stakeholders who provide programs supporting CNCDs. What I'm actually going to do is go forward one slide just to say the stakeholders that were involved are non-for-profits, sports organizations, medical facilities, government departments, educational facilities. And the questions that we asked those different organizations and groups? Or what are some of the challenges within your organization or program? Do you feel there are any gaps in initiatives which should be addressed? How could this be improved? Please consider not only yourself, but possible collaboration beyond your organization. How effective are the initiatives that you're aware of? Are there any opportunities for your initiative program to grow or expand? Are there any agencies that you refer people to? Challenges. What are some of the challenges your program or organization goes through? And these are the responses that they receive from the different stakeholders that I mentioned. Lack of funding, not enough volunteers or staff, need more involvement and assistance from government agencies, inconsistent government laws, regulations, stigma around certain diseases, cultural practices, and health myths, low participation, shortage of patients' funds for treatment once diagnosed, not-for-profits struggle for sponsorship to fund ongoing initiatives and programs, getting parents and teachers to communicate healthy lifestyles, nutrition, outdoor activity, etc. Health insurance may not cover, specific treatment required, lack of follow-up. Can we go through this slide? No, lack of follow-up once diagnosis has been made, negative attitudes from parents and/or self, not wanting to accept or deal with the disease, and need to raise awareness of organization and its initiatives. Here are the gaps. Do you feel there are any gaps in initiatives that need to be addressed? And the gaps listed that came up as the top, so lack of the respite programs for family members, loved ones with mental health diagnosis was the specific item linked to that comment. Absence of disability, financial support for individual unemployable due to mental health issues, need to change school curriculums regarding suggested portion size, sufficient sleep, eating healthy, and physical activities. Time, parents too busy to deal with or take action. Educational gaps about disease prevention, education about disease to family, friends, teachers, employers, etc. Overall level of health literacy, and recourses are not flexible or available. To round up gaps, service providers may offer some but not all services needed for the patient, lack of clear referral guidelines, limited resources for mental health, drug and alcohol abuse, frequency of offerings and exposure to outreach efforts. From an improvement standpoint, how could this be improved? Specific agency needed to manage mental health at the community level and offer services to diagnosis in individuals as well as family members. More emphasis should be placed on education and testing, and they put diabetes and overall knowledge of nutrition and physical fitness. Improvements, better collaboration between not-for-profits / sports organizations and healthcare providers, better marketing of programs, better health insurance coverage, multi-sectoral and team approach to chronic care management. Improvements. Community agencies can be trained better to deliver services within the community, offering incentives, build a stronger referral system between stakeholders, and more child psychiatrists, mental health support for children on island and a child-only facility. Other improvements, government to provide incentives for organizations, schools, individuals who are doing what they should and leading a healthy lifestyle. Workshops and more education, some cover just children or just adults, and may be required for both. So effectiveness, how effective are these initiatives that were just listed? Due to gaps in service, the current initiatives struggle to keep up with demand. Unsure due to lack of data or statistics, so these are the different groups that are giving different answers. Those that include lifestyle change and small support groups are the most effective. Many are successful on varying degrees, unknown if they are not results driven. more effective when staff get involved and have vested interest. So the question from an opportunity standpoint, are there opportunities for your initiative program to grow or expand? And the yeses, the answers were encourage people to get more involved, continue to understand the needs of the community, more fundraising opportunities, could reach out to more people if the costs of assessment and therapy were covered by insurance companies. More opportunities, media support, community involvement, services can be expanded, however, they must evolve away from offering traditional services. With better collaboration, we can move forward. And are there any opportunities for your initiative to grow? And when they answered no, it was due to the fact that there was lack of funding or limitations to a specific population. So that was as quick as I could go through that presentation. And now let's actually talk about it. So that was a lot of information. So not sure if what you all would have keyed on in regards to that long list, but there are a lot of great nuggets in there. And what I would actually like to do, just quickly before we get started and really start having a conversation, seeing as we have experts here, I will go down the line and ask everybody to tell me what you see as your number one issue in regards to winning this war on NCDs, and then what you would see as the solution, potential solution to that number one issue. And I will start with Ms. Anneke Price. We'll go down the line just so that you can see where our experts are thinking, and then I'll throw it out to the group and anybody can raise their hands and we can have the discussion.
Thank you, Shamari. I have been working in the Health Services Authority for 23 years. And over the past 23 years, I can truly say that there has been tremendous steps made in improving the message getting out to the public, either to children. Well, basically we're speaking about children, but I've seen tremendous improvements in the clinics and in the school health programs, in community programs related to children. But what I do see now, I see a lot of organizations doing a lot of different things. The schools are doing some things, HSA itself, the actual hospital, there are non-governmental organizations that are doing programs. But what I see now is lacking is a coordinated effect, a coordinated effort. We need a committee formed, we need a unit formed that can actually bring all of these non-governmental organizations together with the governmental organizations that are working towards that effort of addressing how do we prevent non-communicable diseases exploding in the future in this island. Well, we are seeing a huge amount of numbers now, but what are we going to do in the future? If we don't stop it now, if we don't do what we have to do now, in the future it's going to get way out of hand. So that's the issue I see, is that we need a unit for coordinating all of these efforts. What do I suggest? I would like to suggest that the ministry, the government, forms a unit, a health promotion unit, from where we can coordinate all of these different organizations, all of these different efforts, programs, where we can actually look at what we've got. Then we can actually decide what is effective, what's effective, what's not effective, and we can move forward with actually putting more programs in place if we need them. Because we're here to talk about what do we have here, what do we need. And if we say we can mention 100 things, we could mention 200 things that we need, but if there's no coordinating unit, if there's no leadership from the top come down, then we're just sort of going to be talking in circles, and we'll do the same thing next year and the year after the year after. So I would like to see a health promotion unit established at the ministry level with a health promotions coordinator at the local level with health promoting officers out in the districts. And I think that in doing that, each person can be geared to work with the governmental organizations as well as the non-governmental organizations.
I think Shamari and Annie Kay cheated. We talked about this ahead of time so that she could do that. The rest of us. Shamari keeps referring to experts, and I'm not. I've worked in nonprofit for the last 12 years of hospice care, and a year and a half ago, my son, my perfectly healthy, beautiful son, was diagnosed with type 1 diabetes. And he's not obese. We have good eating habits. He's incredibly active, and there's no reason his pancreas died. So I now live in 2-hour segments. My phone is never out of my hand or out of my reach, and I think like an organ within 2 to 2.5 hour segments. My family and I are what keeps my child alive. So that all sounds very heavy, because it is. So for me, it's not about what's missing in a community. My child stopped being asked for play dates because people are afraid he could die, or he could go high, he could go low, they don't know what will happen. He has not been invited for a sleepover in a year and a half. He's 10. We tried to put him in summer camp, and they weren't capable at the time to feel comfortable. It wasn't that they didn't want him, it was that they were afraid they couldn't care for him. So he can go to summer camp this year. So it's, and we're doing great, and we're pushing through it, and we work together. But what's missing for my family and a few other families, because we're such a small number of T1s on island, there's not a tremendous focus, nor necessarily should there be. But my voice and what I've spent the last year and a half doing is trying to make sure he doesn't feel alone or different or special or broken any more than he is, because he is. The medical services, the specialists, we're so lucky to live here. My endo's on speed dial, and she answers or returns a call within 5 minutes. He had his first ketones. We were in the ER in an hour. We get tremendous care. But he's isolated, and he is alone in many ways. So my expertise is just a mom trying to make sure that I do the best thing. You know, we all worry that we mess our kids up. And I'm just trying to keep mine from being any more messed up than I can be, and to be there when other T1s are diagnosed, to be a voice for other mothers who may not know, to advocate for pushing for the care they need, pushing for the equipment they need. And I'm just very flattered to be asked to be here today. So thank you.
Thanks.
Get started, Chris.
I Super Steve, you know, Annie Kay, I think, took it from all of us. But I would agree with her. I spent probably the last 20 years working with his children. And when I came back in 95 and worked with the Department of Children and Family, it amazed me that we've always seemed to be behind the 8 ball when it comes to addressing the needs of our children. And we either wait, you know, until they get so far that we just can't help them, or we just don't help at all. And I've watched a lot of our youngsters go through the prison system. I've watched a lot of I've buried a number of them, consoled a lot of their parents. And when I eventually took over one of the children, so one of the fundamental things that I found was that a lot of our youngsters struggle with mental illness. And, you know, as a father as well, you know, that have 2 children with mental illness, it's one of the reasons why I say that. Like Jennifer, you know, I have a 19-year-old who suffers from bipolar, and it's not a day that I dread the phone call that she hit her lows and it's gone. And I think, you know, quite a bit in this country, we have an opportunity to get ahead of the game. And sometimes we just choose. Either we choose not to, or we just don't know how. And I'm an optimist, so I believe that we're just choosing not to. A lot of things that I find in the system that either we don't compile our funds because we have so many agencies, private and public. We don't know what's effective, and I agree with Annie Kay. I think there has to be a pool of resources, and we have to do a better job in the private sector and public sector that we have to now start to look on what's effective. And if it's not working, let's change the course. We can't seem to get off of that path of if it's not working, let's move on and let's put them on where it works. Collaboration is a major thing for me. I collaborate with everyone because I need every agency, DCFS, the health services. When I'm dealing with a child with mental illness, or dealing with a child that needs a pediatrician, I don't have time to wait. So I rely on public service and I rely heavily on the private service in order to help us with that. Especially when we find that the parent don't have health care or they're unemployed or they themselves are struggling with mental illness as well and other diseases out there. There's not enough awareness. We don't talk about it. It becomes this dirty little secret that we have in this country. I've heard over the years, I've heard from politicians to policy advisors, hide it because, courts find out that we're gonna drive that up. Our financial institutions are gonna run away if we find out, and it's costing us. It's costing us now jobs. It's costing us. Financial institutions are, running away because it creates our crime problem. The lack of resources that I have seen over the years is that we desperately need a mental health institution for young people. We don't have that. If any one of you guys call me today and say that your child is in deep trouble and they need to be assessed, most we have is put them in pediatric, level in the hospital, which isn't enough. We don't have a drug facility. So when a child isn't being treated for their mental illness, they're going out and drugging and getting drunk. And that's what I am dealing with. Where parents are calling me about 12 and 13-year-olds, or social workers are calling me because everybody needs help. Suggestions to improve this, there has to be more accountability for agencies. My daughters are in the US and I thank God every day that they're there because they get the services. I have a daughter who's 10 years old and struggles with ADHD. She's diagnosed at 10. And I tell a lot of parents that deal with mental illness because it's always the fear of the stigma. And I hear that all the time. What is this one gonna say? What if they take medication? I deal with that every single day for thousands of miles. And I do just fine. But it's educating parents now about what the risk factors are and what they can do to contribute to ensuring that their children still live a healthy life. And I salute you as a parent that you're always sitting on the edge as well, and that's me. But if it keeps my daughters alive, then that's where I'm at. So it has to be more accountabilities for institutions that provide this service, and we all have to be able to get around a table and not only discuss this, but forge a way forward. Quite often, we're just discussing it, and that annoys me to my core that we get in groups like this and we come up with all these wonderful plans. Because I'm a doer, I want to be able to do something, I want to change something. So that's where I'm at. I think there has to be a lot more accountability in the system. I think we have a lot of resources, but we definitely need to reel in a lot of them and have to look at what is effective and what's not, and let's get rid of what's not effective and let's get on the path of what is and make this work. Thank you all for inviting me today.
It becomes harder as we go along. Well, I would just sum it up in terms of the number one problem to kind of go for the different conditions, because as we know, we were talking about obesity, diabetes, asthma, cardiovascular problems, mental. And I think to sum it in, one of the big problems is that we try to fix the problem rather than trying to prevent the problem. And I think that's all what this is about, is trying to go from the prevention aspect. And this workshop is more talking about the early approach to childhood things. And just saying that early, so sometimes you think, okay, it's probably pregnancy. That's where conception starts. But when you talk about smoking, the use of folic acid and so on, where it can make a big impact on the pregnancy, you would know that it's a lifestyle that has to actually start before pregnancy. Because you will well know that many mothers are well into the pregnancy before the age say, oh boy, I'm pregnant, let me stop smoking, let me stop drinking, or let me start using some folic acid. And it's well known that this had started even from before. So we then make the diagnosis of asthma, we make the diagnosis of diabetes, mental disorder. One of the things I wanted to actually ask this morning is what are the gamut of mental disorders we see, because I think that was lacking in the presentations today, because again, do we really know the kind of mental conditions that face our children and the prevalence? And many times then he may then get discharged with the diagnosis, and then now comes the education after the fact. Some things cannot be prevented, and we talk about secondary prevention, which is then, okay, we try to make an early diagnosis and you try to prevent complications down the road. So that is really one of the big things. In terms of solution, in addition to what has been said before, even from our point of view of me in the hospital, we keep talking a lot about team approach. Because, for example, when you talk about asthma, diabetes, and obesity, they're trying to see a child in a limited period in the clinic, then refer to the dietitian or refer to the respiratory therapist and so on. Most times they don't even go. And until they come back 3-6 months later, you found out, okay, but they never saw the dietitian, they never saw the respiratory therapist. And then just everybody is just in a vacuum doing their thing. And one of the things that actually I've been trying to push for is to really have one in terms of a medical setting, a clinic where everybody is there at the same time on the same roof in terms of education. And that's where you're going to try to catch the child. Depending on the age of the child, there are various levels of education that can be had. Then in terms of the team approach and family, and then of course the school where appropriate. When we're talking about the mental health, the soft one, in terms of mental health education and management. And then of course the ministry, but ministry last, but as you said, it starts from the top. But one of the things is that everybody is doing their thing in isolation. The psychologist sees, do their little thing. I have very little access to what they are saying, and I'm trying to rely on what the parents sometimes say, and we get sometimes some feedback. And it's the same thing with the respiratory therapist, the dietitian, where yes, I can probably really know sometimes if they are within our system. And it's everybody doing things in isolation, so you have that education and team approach, but everybody talking to each other. That's something.
Yeah, and actually one of your questions was about what types of mental health. The things that we see are ADHD, OCD, bipolar, lots of anxiety disorders. I used to work in the government in the education department, and I worked for early intervention service for 5 years, and I think they liaise with you better than maybe some of the other teams do. But we don't. There's two or three things I'm trying to sort of slot them together so they make sense. First of all, the people that come to us at Special Needs Foundation, parents now are quite happy to say, oh, my child's dyslexic, and even autism now seems quite popular. You know, people are quite happy to say, I've got an autistic child. But then they come and whisper to me, my child's got mental health problems, and they're just embarrassed when they do it. And yet, really, the issues, you know, the way that we can support them is exactly the same, and we don't want them to have to whisper to us in a corner. You know, we want them to feel free that they can actually say what the issues are and what they need supporting. So that's one side. I think the sort of main issue that I see, and certainly my involvement in early intervention that I see, is we just don't have enough support when children are young. So even in early intervention, we sometimes have children that we knew, as well as they might have speech and language problem or whatever the reason that they came to early intervention in the first place, but it was very, very clear that they also had some underlying mental health issues that were starting to develop. And yet we only had about 3 hours a week access to a counsellor who actually didn't really have those 2 or 3 hours a week because they were so swamped with their other workload. So they didn't have access to the families. I built up about 4 days a week with early intervention, which was great. I was doing a lot of consultation, a lot of assessments. lot of preventative work, and then my time got spread further and further afield, and I ended up with about 1 day a week for early intervention, even though the number of children they had increased. So we need, even at that very, very early stage when the things is first starting to be recognised, if they had access to counselling, had access to psychologists, to get in with those families really early, some of these things wouldn't develop. And certainly then even on into the primary school, there are a lot of children who are behaviour problems in primary school, but actually have mental health problems that aren't being dealt with, aren't being expressed properly, and they exhibit poor behaviour. But again, counselling and psychology support across the schools is just not enough to deal with the number of children there are. So to me, if you can get in really early, you can prevent a lot of this. If you don't deal with it early, through the primary school, they become more and more of a behaviour issue, they start getting sent out of class, out of school, it becomes a bigger and bigger problem, and then, my goodness, when they hit puberty, if you haven't dealt with it before they hit puberty and they're at high school, especially depending on which high school they're in, you have a massive, massive problem. And then they're a big behaviour problem. And then, of course, they end up on Michael's at-risk register because, I mean, and Mike, I worked with, when I was still with government, I worked on Michael's best teams. Wonderful. Michael, I have utmost respect for the collaboration that he has tried to do, and trying to get the services these children need has made a massive difference. It needs more, but he needs access to more professional help. He needs more psychologists and counsellors in the schools so that when he highlights a need, that we've actually got time to deal with it. But I think if we can so the solution to me is more access to support as soon as it's spotted, and a lot of it is spotted during the 0 to 5 period. If you can get in there and support those families, then by the time they get to high school, these things should be dealt with. And if they need mental health support, if they need, we need a child facility, absolutely. But a lot of these things, and some children do need to be medicated. I don't like medicating children very much, and I think a lot of it is, I do a lot of in-home behaviour support, and a lot of things can be tackled that way. But some children do need to be medicated, but then it also needs to be monitored. And there's not enough. Some of the counsellors in the schools are wonderful, and they will help to try and monitor a child's medication. Some of them won't, and some of them just don't have time. So there's a lot of issues there. But to me, it's getting in early, spotting the problem really early and doing something about it. But that requires enough professionals who have been given time. One of the reasons I left government actually was because I was being told to deliver services that weren't helping anybody, and I was being moved from the things that were working. I was being moved from some therapeutic work I was doing, and they wanted me to do things that weren't going to help anybody. And it's like, at some point you have to step away and say, professionally now, this is not, doesn't match my training, it doesn't feel good. So that's why I stepped away. But I think people need to be able to deliver their expertise. They need to be encouraged to do that. And some of the counsellors on Ireland, some of the psychologists on Ireland are wonderful, but they're not always allowed to do their best work because of the way that they're line managed. Right, there's quite a lot of different stuff in there, but I think it's because I'm coming at it from different perspectives, from a psychology perspective, but also then special needs. But I do, from Special Needs Foundation, I still find it very sad that parents feel they have to whisper that their child has a mental health disorder. And I mean, for Jennifer, one of the things we try and do is a lot of special needs children, they don't get invited to things, they feel isolated, and that's one of the reasons we provide family and parent support. And we're starting to do, I've only been with them since March, social events where they can come and they can feel that they're included and that they belong still. So you'd be welcome to come along to your child, even though it's not a special need as such, it's a medical need.
Well, I think I consider myself fortunately sitting at the end of the road as I've had a chance to listen to everybody. And as I break it down, I can break it down into two separate categories. The first one, it's all about mental health and well-being. So the overriding discussion here is going to be about mental health. But I think some of the speakers or some of the folks here have a very appropriate agenda of individual mental health disease for individual patients. And then what I look at more from my perspective is the community mental health issue. And when I'm talking about community mental health, I'm talking about a vulnerability to addiction, I'm talking about, because almost all the chronic illnesses that we've talked about start in the childhood era, where you've got higher rates of alcohol drinking, maybe not alcoholism, but drinking alcohol. I overheard a conversation a little bit ago that of 10-year-old kids, somewhere between 30 and 50% of 10-year-old kids on this island have had a sexual experience. Correct me if I'm wrong about that, but that's a serious issue. 22 to 30% of the kids are obese. We've got drug addiction, so we've got a number, and that to my mind is not a substance abuse problem, really is a mental health issue. It's not a problem, but it's a mental health issue that can be solved at a community level. So there's an infrastructure issue that we don't have enough facilities and enough ability to take care of individual patients who have an organic mental health issue. And we've ignored that, I guess, because there's not a lot of money in it. A lot of money in treating diabetes and hypertension, all those things, but there's not a lot of money in mental health treatment. But clearly, I think this island needs a facility where you can have an inpatient, outpatient, intensive mental health organization that deals with organically ill patients. I want to focus more on the other side, on the addiction side, and who's vulnerable to addiction. And the work that I do, even though I'm a surgeon, more and more I realize that surgery has a very, very limited role in managing obesity, which is my specialty. And what I've identified is that every obese person comes from a background that has a vulnerability to addiction. Everybody's got equal access to carbohydrates. We can all have them. Why do some people smoke, some people don't? Why do some people eat carbohydrates and those that don't? And really, every human being, you can talk to someone for 3 to 5 minutes, and every human being has a dominant way in which they handle emotional needs. Some people consume substances to manage their emotional needs. Other people can generate emotional well-being through action or activity, something they do versus something they consume. And when you look at those two groups, those that have a vulnerability to substance consumption have a poor sense of self. And those that are able to generate emotional well-being from within typically have a good sense of self, good self-esteem, good sense of self. And where does that poor sense of self come from? It comes from us as parents. So there are parenting styles that either erode or don't develop a sense of self in our children. And while it's easy to breed, it is incredibly difficult to be a parent, and there really is no education about being a parent. And I hear some of the people, even those folks with organically ill children, they have no capacity to understand, what can I do? We're looking for the system to help us, and there should be a system role, but what can we do? And I think at a grassroots level, in a small community like the Cayman Islands, that's a closed community, you have a wonderful opportunity as part of grassroots education to educate parents about authoritarian, authoritative, permissive, neglectful parenting styles, and get them to understand that aspect. Because a lot of these trends are not genetic. They transition from one parent. I was raised a certain way. I became that person. I raised my kids in that way, and they become that person. They're going to separate that over the generation. We can intervene at a school level, not necessarily a medical level, but at a community level. And that, I think, will be my focus, with obesity maybe being one of those topics.
Thank you, panel, for getting us started and running. So I want to throw it out to anybody in the group, whether you have any comments in regards to anything that you see as an issue that was major that wasn't covered, and or from what we're hearing, any solutions that you may also thought.
I've listened to everything that the panel had to say, and some of what came up from the survey that was done. I'm with Children and Family Services, have been with Children and Family Services for many years, and we have struggled over the years with the issue of parenting at the basic level, and arising out of that, worked at a community level with the entire community, all 3 islands, to develop comprehensive parenting, which started from a prevention stance to work with parents to help to enhance their skills in the hopes of reducing some of the issues we see arising down the road. That program is developed and is working well, and it's being run through another entity now. many other programs that have been developed from that point of view of working at the grassroots level, whether through community development and doing community-based education. Where I think issues arise, even though at the baseline level we at times work together, I think we need to have things done more on a national level, pulling everybody together so that we can see proper strategic planning developed, targeting all the different areas. We struggled for years in regards to, yes, you need prevention, but we also are dealing with the issues now that need the intervention and need the resources. You're working with children and not able to access proper psychiatric or psychological assessments to make sure that what we're trying to do with them as professionals is the appropriate thing, because you might be here doing the best thing for them and it actually is not the best thing for them. So on different levels, I think we need to start, we've banded around for years continuum of care. Continuum of care for me means not just about the provision of residential or treatment facilities. It connects with the scope of services that needs to be put in place from a preventative angle right through of intervention all the way. So it's working with the community, it's working as professionals to make sure we can spend the time and deal with the issues and prevent other issues from arising. Because Michael is right, we have been here and backing our heads against the wall and working the best we can, but in the absence of adequate resources to have the bodies able to respond as we need to respond and having access to other services that could really make a difference, we're falling down. So while we can do the education, we need everything together so that you have the scope of things to tap into while doing the education, while working on the preventative end, but also having available to you the appropriate resources to deal with the issues we are struggling with now, to hopefully avoid those kids that we're dealing with now, 8 to 16, from ending up in Norfolk prison in another 5-10 years. So it's a multiplicity, and the issue about mental health, specifically mental health in the broad sense, but children we are seeing who, as a result of having been molested or any number of other reasons, who are exhibiting mental health issues, we now have to be seen working with health services to send children off island. That's not in any realm of reality good for them, but there's no options available on island, and they require at least short-term residential treatment in order to make a significant impact in what they're experiencing.
Anybody else?
Just to speak about the lack of, we call it allied professionals. My son has certain issues. So, well, my children, basically. So what I found, they go to private, they go to public school, and I'm a government worker, so I have to access the service that I have access to. So what I find that it is a very real lack of supporting professionals for children here on island. When you're told that my 5-year-old daughter, she was in early intervention program, that she's supposed to get speech therapy, and there's no speech therapist because the speech therapist was only there for 6 months and she left the island. My son should be assessed for a learning disability. He cannot be assessed for a learning disability because he cannot, there's a wait list a mile long, and he's on this wait list for the last 2 years, and he cannot be assessed to get diagnosed for something that I know that he has. My daughter had she was being bullied and stuff like that, and she was exhibiting certain symptoms in primary school, but then she didn't really get assessed by the psychologist until she was in year 8 at high school. And even then, she had to wait until she had this, the psychologist was able to see her, basically. So there is definitely a lack of special professionals trained to handle children. And it's really sad when you really want it, you need to access it. I'm a parent, I'm concerned, you know, I do all the best that I can. I go to Dr. Robinson points me in the right direction. I try to access what I need to access, but yet, you can't access the service because there's no personnel, basically. And even if I was trying to see certain things. If you go to the private sector, if your child needs to be assessed, it's $3,000 to $5,000 depending on what it is.
You can actually get assessments from $1,500 up. I think the most expensive one I have.
No, the one that my son needed was, she told me, just to screen him is $15,000, and then if he needed a special one, it was close to $5,000. And really, as a public servant who is on a limited budget supporting kids, you cannot do that, really and truly.
I can speak to you about the people who provide the assessment.
Yeah, I understand. I got some assessment and I got some things, but really and truly, as a parent, you know that your child needs the services, but yeah, at the same time, you cannot access the service because if you don't have the resources, the professionals are not there at the primary school level, and then sometimes you have to wait until they're in high school when they're dealing with other issues, and it exacerbates the problem and stuff like that. So I can speak to that as a parent who has experienced it in the system.
Which schools do children come?
John Gray, Johnny Conver.
So I haven't worked at John Gray, I have worked at Johnny Conver, and I've worked in lots of primary schools, and I used to work at George Hicks, which then became Captain Hunter. But within the public schools, there is a code of practice, there is a psychologist, a counsellor, speech language. Let me just finish. I'm going to
talk. You can talk,
so
but that's not what I've experienced.
There are those people assigned to the school, but in the school there should be a Senko. Michael knows about this. There's a named Senko, but whether they're actually given any time to do that role is a different issue. Every school is different. Some of the schools are absolutely great at making sure the children, once they've been queried, they should go to phase 1. The teacher should collect information, it should go to phase 2. The school should gather information with your support, and that you should never be waiting. If your child meets criteria, you should not be waiting more than a few months, 2 or 3 months for an assessment, because those professionals are on. I mean, there's not enough of them, but they are there. And if your child meets, this is the thing, they have to meet criteria. But if they meet criteria, you should get. There's a code of practice that states your assessment has to happen. I haven't got it on me, but within a certain number of days. And I think it's 60 working days, and then you have to get a report within another 30 days. You should never be waiting 2 years for an assessment. And what I would say to you as a parent is, if through either of the schools you are not getting access, if your child meets criteria on the code of practice, then you need to go straight to the education department and take it up with them, because some of the schools are better than others at actually making sure that children receive what they're entitled to. But you should be, so I would say any parent in the room who's not getting that support directly in school, you step up to the education department and say, my child, at the very least the school has to gather the evidence, and Michael's best teams do some of that. Where that will be different is if the child doesn't meet criteria. And sometimes parents see something that the school isn't seeing, and then it might be a case they may need you to gather more information somewhere else. But you're quite right. If your child is in a public school, you should not need to pay for a private assessment. But there are private assessments out there that are a variety of costs, and on an individual basis, I can explain to parents why there is a difference. But they're not all, they don't have to be that expensive. But that depends. But you shouldn't have to pay for a private assessment if you're in a public school. You should have access to a free assessment.
I understand what you're saying, and what you're saying is correct, because my children are getting they got assessed and whatever. But it's very difficult as a parent to hear that you have to wait for the speech therapist because or she left the island and you don't have anyone, you have to wait the following year. And
That's not right. If
Yeah.
your child has been assessed and they say that your child is entitled to speech and language therapist, whether that therapist left the island or not, they have others within the system, and if your child is supposed to be receiving it, your child should be receiving it. And again, I would take that up to the education department if the school is really not opening up the school. I don't know if my teacher agrees to that, but if that is in a report that your child is entitled to speech and language therapy, they should be getting speech and language therapy. It's not your issue that someone left the island. There are other speech and language therapists that work at the school.
Is there a reason why the insurance companies are reluctant to cover for mental health issues?
My opinion about the insurance companies, I think it's a little bit tricky, but I think what's happened, some of the disabilities that require therapies, and therapies seems to be all grouped together. Speech and language therapy, occupational therapy, mental health support, social skills group, anxiety work with anxiety. There's those types of therapy, but there's also one of the autism therapies which is delivered on Ireland is ABA, which is, they sometimes say your child will need 40 hours a week. And the insurance company, I believe the insurance, this is my personal opinion, not the Special Needs Foundation's opinion. My personal opinion is that the insurance companies are frightened. They think that if they give money for therapies, that they're going to have everyone wanting 30 hours a week of ABA. And I think if ABA could be separated from other therapies, I think insurance companies would feel less scared to provide some therapy. Even if I think it's Brit Kay that will say you can have this much money per year towards therapy. And it's maybe not enough for some children, but at least it's something. But I think it's the very, very high cost of ABA, I think, has scared insurance companies. They don't have, legislation means they don't have to provide it, and they're worried it's going to be too expensive. Special Needs Foundation is currently in the process of trying to do some research on Ireland to actually really clarify the prevalence of disabilities on Ireland. And what we're hoping, one of the things we're hoping to show from that is there might only be a very small number of children that have this problem, and their therapy actually might be quite cheap. So actually, you don't have to be scared to offer that therapy for those children, because it's not, you're not opening floodgates. My personal opinion is that ABA, which is hugely expensive, has scared insurance companies. But that's my personal, Susie Bottom's opinion rather than Special Needs Foundation.
Because I think that's a deterrent, because if you, not just at a child level, even though this is about children, but just across the board, if an individual feels the need to see a psychiatrist or a psychologist or something, to hear that you have to spend $300 upfront or even $200 upfront alone is a deterrent, in my opinion, to even start the process. So I think that's a contributing factor to the whole mental health situation. So it's something to look into and see where the way that
we did have a meeting at the ministry just the other day that was talking about exactly this decision. And the ministry do seem quite sort of keen. It was a group, Special Needs Foundation, parents, and I have to say the ministry were very open at listening to those issues.
What I've also experienced is that ADHD is also classified as a learning disability as opposed to an illness. So a number of insurance companies, and I've run into this because I've done extensive research on trying to help parents get that covered through their health insurance, and insurance companies refuse to cover it because they think it's a learning disability. So they refuse to pay for therapy, they refuse to pay for just small things to treat it, they refuse to pay for medication because they believe that it's something that keeps the child focused to learn as opposed to treating the child with mental health. So like that's the challenges that we are running into at this point. There's also been a shortage of medication through the hospital, and it is highly, I'm sure you guys are aware, kids who struggle with mental illness, it's just highly expensive. I've reached out to several pharmaceutical companies and been trying to broker them, bringing in a cost. Have children that I work with, that many of their parents are underemployed or unemployed, and many of them don't have those children on their health insurance. When I spoke with the Health Services Authority, I was told that it's against the law for a parent to not have their child on their insurance, but in our reality, when your insurance premiums is higher than what you actually make as an income, and it comes down to putting food on the table, keeping your lights on, the last thing that you are going to think about is paying for medication. So a major issue that we're running into now is many children don't get their medication. And so we reach out to many pharmaceutical companies. But because the government taxed that, at such high ranges when it hits our dogs, they refuse to actually donate that. We brokered, all of the pharmaceutical companies just donate to one child a month, until we can work with DCFS and get the child long-term health care. But the child need, like Jen said, we need that now. We need that intervention right now. We don't need to wait 6 months down the line. And it's challenging. It's challenging to get pharmaceutical companies on board because they look at the cost of that. Things like Concerta and Adderall and so forth. It's highly expensive medications, and that's what we're running into.
Just to add to that, if there are persons who don't have insurance coverage, who have a need, they go through the AA for the assessment, and then that gets sent over to DCFS, who then goes to try and get coverage. And we normally try and deal with those, especially where there are children involved, because we do see a number of persons, some who at times may have insurance, but it doesn't cover, it excludes the type of medication the child needs to be on. So we've had to, in the past, provide indigent coverage to pick up that coverage to make sure those children are getting the medication that they need.
Yes, you mentioned that. One of the issues I found, though, again, it comes down to resources and manpower. Because sometimes they come back to us and say, you have to put urgent or staff or something to get assessed.
Yeah.
And then when it comes to mental health disorder, unless they're suicidal or something, you put urgent or staff on it.
Yeah.
You put as soon as possible. As soon as possible could be 6 months to a year, absolutely. Whereas if it's a cardiac, then everybody's scared.
Yeah.
Say, okay, yes, we're going to meet tomorrow and try to get you the coverage. So again, resources and manpower come into that again.
Yeah, because the needs assessment unit, the welfare functions that we used to do in DCFS has been removed, and that's now set up under an entity called the Needs Assessment Unit, which falls directly under the Ministry of Community Affairs now. So they have to do the assessment, but once the assessment is done, it comes back to DCFS, because in the health insurance law, we are the entity that has to determine indigency. I am aware they're very short-staffed, but I think if those issues, especially where it's a child, we need to flag it to them as priority to try and get it dealt with as quickly as possible.
But one of the other issues is that every day we are writing all this stuff and priority. It again, whoever is on the so-called ASAP list get pushed down further and further. And so it's forever.
Okay, so I've listened to a number of excellent comments and some solutions are embedded in them. It is appalling though that we have all of these ideas going around and still we're having the issues, so I hope something can be done. One of the things that I have seen is that the collaborative efforts are not consistent. Like you'll have foundations coming together today and tomorrow they are non-existent. I don't understand what Kimberly is too transient. I don't understand what's going on. And because of that, we're having issues. For example, yes, a child might not have mental health today, but because they have some medical problem, for example, my child has asthma. And I noticed just the steroids medication, so she's going to put on. And then eventually she might feel like she's feeling fast. And it goes on and on. So we need to have this collaborative effort and they need to be consistent. Government also needs to be consistent in what is tried and proven and tested and work with that. Because we change too much.
Just something I wanted to ask the panel, or especially the pediatricians. I mean, I was just saying to myself, just listening to the conversation, that having worked in Jamaica and here at a pharmacy, I noticed that there's a very high incidence or higher incidence of ADHD and all of these mental health conditions here in Cayman versus when I practiced in Jamaica secondly because we're old. And it would be interesting to at least question, you know, what do you think is contributing or has contributed to that disparity. I have never had to work with so much cases in children in Jamaica. It wasn't until I started to practice here that I noticed. So I'm just throwing it out there.
Well, I don't know
If
the
there's
stats.
any insight.
I don't know the stats for Jamaica, but sometimes if you have better access, that alone is going to give you a false impression that there's incidents. Because most of the patients say we can write the medication and then we don't get it. From my personal point of view, and I think from the pediatricians, I usually get them assessed first, not just the mother coming and saying, my child is running around the room. Okay, here is the prescription. So I have a feeling more is more making the diagnosis. And it's probably access to the assessment first, and then having made the diagnosis, being able to write that prescription for them to get it. Probably if you go actually on the ground in the school system, in preschools, you might find that it's probably not different.
Okay.
But sometimes you just accept it or cope with whatever it is. But I can't talk authoritatively because I really don't know the stats.
Okay.
I'd like to speak to it for a moment. I can only speak from my personal experience, and that is of a doctor in the States. His name is Dr. Senior. He's a psychologist, and he owns and runs well, it started off as a boarding school for boys who have ADHD. And it's been in existence, I think, for the last 10 years or longer. Now it's like extended to girls, and it's a very successful program. And some of the children taken there have to actually go under guard because they refuse to go. They don't want to go to the program. And the program addresses the base foundation of what the problem is. Why is this child behaving in such a disgraceful manner when his parents are, they're educated people, they're brought him up in a nice home. And what he does is he separates the parents and the children initially. And he puts the children on programs, and their programs include, that would be a nutrition program, special nutrition program. He prevents them from access to media, including cell phones, so they're not allowed to even speak to their parents for about 6 weeks because he's going to be counseling them. And after 6 weeks, he brings the parents now. They have to now start attending every 6 weeks. They have to attend a counseling program, and he counsels the boys every day together in a group counseling, and he gets to the base of the problem, changes their lifestyle habits. And boys then eventually will come off of the medications they're on. He's managed to take all of the children practically off the medications that they're on. He actually sees them, he schools them at the same time. They're actually being educated. And he follows them right through university to see what the end result is going to be, whether or not they lapse, or whether or not they need to come back, whether or not they're going to graduate and become professionals. It's a very good program. There's 2 boys in Cayman that I know went there and came back here and have been living very well. One of them is in university in the States right now. And the other one has a job, and he's totally a different person.
Just in that instance there, you said it though, haven't
If you
you?
Google Advent Home, yes.
But in that statement you said it, there's a legacy, it's sustainable, and there's an impact.
Yes.
And without those 3 things, you're not going to address anything. If it's not going to be sustainable, it's going to go back to square one. If it's then sustainable and there's a legacy that we all have a vision to work towards, fantastic. And the third one, which is there, it sounds like we haven't got the high quality service, high quality to manage them, high quality events. That's the way you're going to hit this target that you want to. Whether it's obesity, whether it's mental health, it's the high quality that you're providing. and then after that, you can measure the impact, and that's what you just described there. It's sustainable and impact.
The parents are involved, it's sustainable.
And the schools are involved. The schools are involved, the health people are involved, they're all putting together to that one target. And by measuring the impact is what they're doing at the end. That's what your working group, which is what you're talking about, need to get together for, to put it all together and work it that way.
You inquired, I'm Lyndon Swan, I'm pediatrician with the Health Services Authority. You inquired about the ADHD and the cases, the numbers you see. I see one of the things, I work in other jurisdictions, one of the things I see here working in the Cayman Islands is it's pretty small. So you tend to see quite a lot of things that, wider spread population, people spread out in more areas, so probably. But you're correct that you probably see more cases than are necessary. I mean, I've heard the sociologists and psychologists would speak more to this in terms of Cayman being an island or a country that has grown rich very quickly, And the question I ask is, one should ask about the leadership. Anike raised a point in terms of coordination of services. Coordination of services, I think, calls for strong leadership at a governmental level, at a ministry level, etc. Very important. You cannot have 100 organizations doing their own thing, looking after their own little interests. I work in jurisdictions in which what you get for $1 out there in other jurisdictions, it takes hundreds or thousands of dollars here to get the same result. What is happening? Is it those resources are just going in certain directions, or is it being wasted and it's not being put to proper use? I think it calls for strong leadership in terms of ensuring, whether it's legislation or otherwise, that you have proper coordination of the services, you have proper accountability, etc. I think there's a place for government. There is a place for government and coordination of services. If you drive down the road and there are no traffic lights, there are no stops, there is no coordination, there is no order, there is no rules, we'll all be squashed on the road. There must be stops and checks and balances. And I think that's a place for leadership in terms of at a ministerial level, etc. I think Dr. Hospitalis, opening his comments yesterday in his first presentation, he talked about, are we all health workers here? Where are the tourism people? Where are the other people from other jurisdictions, other ministries? Very important when we look at the problems of children in this island. It's quite significant. And I think it calls proper coordination of services and proper strong leadership to really get the services together.
So we're going to champion that. Because
I think that's why you have elected officials.
The government is us.
No, I think that's why you have elected officials and they, etc.
Yeah, but I should come back to the question. After all the discussion here, and we say up to the leadership in government, who is...
Well, we all can champion it, and I've heard from all the speakers here, and persons have been championing, I think, just to continue to go forward, to push forward, to make these presentations known, etc., and put it in front of the leader. I think everyone is interested in doing well. I think that's basic human behavior. We all want well, we want to do well, I think that's the first thing, honestly.
It's advocacy too, from you talk about who champions that, and I think we all do. In our case, there's so few T1 children on the island that when it came time to get education when he was diagnosed, there was nothing. So, and insurance wouldn't fund sending him overseas, and we're talking about the indigent populace. Working, it's $1,800 a month for insurance. You're having another $400 to $500 a month in medical supplies for this child. And education is what will keep him alive as a man, and will keep him out of trouble, and will give him the support that he needs. But insurance at that time would not support that because it wasn't a urgent care case. And my explanation was, if it's an urgent care case, it means you're sending overseas to be cremated. Because as a diabetic in an urgent care, it's too late. So that education now, I'm not saying as a direct result, but one of the insurance issues now has changed. So there's a $500, a lifetime $500 education clause in the insurance policy now, which would cover about almost his plane ticket to where he needed to go for education, not including all the other things he needed, all of that, but it was a step. He needs an insulin pump. He is the first Caribbean-approved insulin pump for juvenile ever. He was approved in April. He still doesn't have it. It's We haven't figured out how to get it out of Barbados because it has to go through the US because it's a US provider. We're working on it, and we're all working on it. There's about 16 people trying to get this kit pumped. We've got people, the phones are still ringing, trying to get it here. In the meantime, we went through government saying, can we get juvenile type 1 pumps duty-free? So that took several months, and they've agreed to do that now. So children under 18, when we were able to get them a pump, will come in duty-free, not the pieces, but the pump itself. So it's not, we want to point the finger of who has to do that. Well, I have to do that. That's my job. And as a parent, it's having the courage and the support, and fortunately, the education and the phone numbers and the contacts through the health community to do that. Well, that was what we were talking with Shannon was speaking this morning about that first responder or anyone who's taken the Darkness to Light program about, as a community member, identifying sexual abuse in a child. All of these things, there are resources here. The Darkness to Light program is a perfect example. It's a free course that the Red Cross offers. It's 3 hours, and it teaches each one of us how to identify a child that may or may not have been sexually abused. I took it years ago. It was incredibly empowering because it wasn't, I can fix something. It was, we all have the ability to fix something if that community approach. And it's not going to stop children from getting diabetes. It'll stop children from having mental health issues. But it's knowing that you've got the YMCA linking up with at-risk, linking up with HSA, and it is available. And we have this incredibly educated community with massive resources, and it's a very rich country, but it's tapping into it and nobody backing off and just saying it didn't work. It's fighting in an eloquent and positive way to make sure that all of our kids get the best possible care and, growing up experience this we can. It's getting a kid to see a therapist when they need to, as quickly as they can, without the stigma, with all that stuff. But, like the gentleman said, we all have that power.
And I think coming out of this, for me, I think the recommendations that go forward from this conference, again, can help to feel like to push that this has to be everybody's business, and it has to be something that's driven from a national level as well, right? As well as grassroots community people taking ownership and pushing for these services and interventions to be available.
I agree. It is a top-down approach, and I agree with Dr. Swan. I think what I struggle with, and I've struggled with over the years, is that, as a government, and we almost wait until it becomes crisis,
yes,
and then we're spending millions of dollars to deal with that. We did it in the 80s with drugs and so forth, and we waited and waited and waited, and we see the crisis with this illness and a number of disorders and diseases that we're now trying to fight when it's costing the public purse. And what I've always tried to do is provide statistics. Years ago, we were always quoting American statistics or the UK statistics or Canadian statistics. Have all of that now. We are now skilled enough that we're tracking all of these things. Mental illness is the third, disease or disorder that we diagnose in this country. We don't have a pediatric psychiatrist. Education alone, I can tell you, we need a psychiatrist at this point. We've had folks from Dr. Barnaby, Dr. Lockhart, and all of these mental health professionals say this is an epidemic in this country. I take your point in saying, that there is an inordinate amount of children that's being diagnosed, and a major part of that is because of folks like Susie that have been in the system. Back in the 90s, 80s and 90s, there were maybe one ed psych care. We now have 4 in our school system, 4 or 5 in our school system. Wonderful people. But to Susie's point, she was underutilized. She spent most of her time filling out reports that no teacher ever saw and no one ever listened to. And it's my frustration because they give me those reports. And when Susie's saying, child needs therapy, the child needs this, the child needs that, the child needs that. This is where, the behavior and education support team came from. Because I was tired of seeing ed psych reports. Those ed psych reports cost us, on average, about $3,000. We are pumping those things out like hotcakes. And you look at the back of it and you have all of these recommendations. And I am saying to the school, now what? Okay, we need therapy. Who's going to do that? We need this, we need that. We need to get the parents to the table. Or, you know, you have your, you know, issue where you're saying, you know, we need speech, and where the hell is the speech therapist? Well, you know, who's going to do that if we don't? So I have gathered a lot of these people together and saying, you now need to do it. And someone have to put that. But it is, you know, to Dr. Swan's point, this is a top-down approach. What we've tried over the last 30 years is a bottom-up. If people like me that's in the system, you know, at the end of the day, yeah, I'm a mover and shaker, but I'm not the minister. You know, let's focus on the ministerial level, start to buy into it. And I've often said, until it affects their children, until it affects their families, it may never be done. But it comes from you as well. It comes from you as a class level, grassroots people that's going to say, as a voting citizen, here's what I want to see in the votes. Here's what I want to see that you're going to accomplish. And I think it's your responsibility to hold us accountable as your government. You know, but hold your political leader responsible to say, I want to see that in the next 6 weeks or months or whatever, we have these services and they're accessible to everybody in our community. And unless we are saying that as a community, it will never be done.
I used to say to people in schools, you know, they'd give you a list when I first arrived on Ireland, give you a long list of all the children that need to be assessed. And when you go in, and in the UK, we do a lot of preventative work. We do a lot of consultation, we improve the quality of the teaching. We work with the senior management of the schools to improve things in the classroom for all the children in the classroom. And I would do an assessment and do a report, and you say, that doing the assessment does not help the child at all. You now have to, instead of putting this in a filing cabinet and ticking the box, you have to read it. You have to share it with the teacher. They won't even share it with the class teacher. The teacher has to read it. You have to put these recommendations in place. And another example, when I first was here, we were asked to do, and it was decline management. We had to do a monthly report of the work that we did. And I had like a 3-page report every month, which was I had no problem doing. And I listed all the therapeutic work I was doing, which included puppet work of young children. And actually, we used to have some big, tough kids in George Hicks High School who come in my office, and they'd be looking at this puppet who just happens to sit there rather than driving him home every day. And I go, oh, sorry, I forgot to introduce you to Hugo. These big, tough lads that were just real trouble, they had that puppet on their lap within 5 to 10 minutes every single time, and they'd be cuddling this thing. So I used to do a whole range of stuff, and it got to the stage where that all they wanted me to do was send an email once a month, how many assessments did you do? That's all they wanted, and they didn't even say, and did anyone read it? Doing assessment, and that's the government now, is they can say, oh, we've got this many psychologists, we did this many assessments. So what? It doesn't change anything for the child unless someone reads it and puts it into action, which is where Michael came in, and he does the best he can do, but he's one person, and he can't be in every school making sure that every report is actioned.
Now that she brought up a puppy, I can talk. I'm actually a veterinarian, and I'm really interested. I have 2 kids. I'm interested in mental health, and I'm interested in, you know, helping young children, all children really, the way that a lot of people here put their heart and soul into helping puppies and kittens. And I think every other fundraiser down here is the Humane Society or CARE or One Dog at a Time. And although that's near and dear to my heart, I think it's, I've been here 17 years, I think it's ironic that the children are being abused, are being neglected, are slipping through the cracks, and then essentially at the end of it end up in the prison system. That's the past, and everything that's happened on the island up to now, we can't change, but if we can somehow iron out some directives and put a team in charge of coordinating everybody's variable efforts, getting funding from the private sector as well as government. I mean, we can't always have our hand out to government because they simply do not have the money. Lobbying with insurance companies that are coming here, making lots of money off of various financial ventures as well. That, you know, mental health is a disease. It's not separate, and it's not second to the actual physical diseases that they will pay for, and lobby lobby the ministries to make changes, don't put the Burger King beside high schools. And, instead of trying to reach an individual kid that's in pain, maybe go into schools and talk at the assemblies and bring in speakers from overseas that are really empowering and, spark an interest in a kid and give them some hope for the future. Because that's basically the basis of self-esteem and the basis for not, hurting yourself with food or drugs or whatever the case may be. And if we can get them, the parents, it's important to, I'm a parent and, I certainly didn't do all the right things. One thing I didn't do is get my kids. I don't agree with losing control, but not a lot of people agree with that, and that's their business. But other things I might have done wrong, but at the end of the day, maybe not looking to the parents, because maybe the parents can't be taught a different way. Maybe the parents, if they're not physically abusing them, then they're using their words and they're emotionally abusing them. And then they have to go to school and deal with all that. They need somebody to talk to, not just necessarily an adult that they can't relate to, but if we could teach maybe the higher grade kids that have an interest to form peer support groups, so the younger kids could go to them and they could have summer camps. I think here, I'm really fortunate in that I'm able to send my kids to camp and pay for it, or send they can do this, or we can go on vacation. But spending the 2 or 3 months in the blazing heat here, and I often think, like, what are those kids doing in West Bay? Like, what are they doing? They don't have a pool. They, if we could gather the funds and have, we're going to have this really great camp. We're going to teach you how to do this. We're going to go dive. And very few Canadians even know how to dive. And teach a lot of the kids that are coming out with counseling. I personally know, from my family's standpoint, having to try to find resources on the island for counselors as well as psychiatrists. We recently also lost a psychiatrist on the island, so it's like, we barely have any, and then we lose one and we don't get anybody else in replacement of that. So the resources are really stretched thin. Even if you have the money or the insurance to pay for it, you can't really, it is a struggle to try to, be your own advocate and try to, take care of your family in that regard. So I do think that we need to bring in more, therapy people, counseling people, mental health, and otherwise professionals. But really reach out to the kids and get to them to let them know that we do care for them. Much like, the little puppies can't speak for themselves. We have to, it's our responsibility to take care of our youth.
Can I ask a question? In terms of the Mental Health Commission, I'm assuming that they're aware of most, if not all, of the issues. And the body, because again, I'm coming back to this thing about championing it, and because my thing is we make these recommendations that was alluded to before, but what's the next step in terms of direction? Is it that it goes to the Mental Health Commission, who then represents this to the government? How does that work?
You're asking the wrong person.
I'm the moderator.
You're asking the tourist.
Just to say to you that my understanding is that there is a group that is presently meeting in regards to mental health facilities in looking at the development of mental health facilities for adults and I've said to my chief officer we need to be pushing for facilities for children as well, because I remember back when the hospital was being built and the small unit was being put there, my argument was, give me 2 beds that we can have access to for children. And that wasn't thought to be feasible at the time. And the understanding I have is that they're looking at the development of mental health facilities on Ireland, and in the scheme of things, that something will be put in place for children. And again, I'm not advocating locking up children, but we cannot walk away from the fact that there are a certain number of children that need short to medium term inpatient care in order to get a handle on whatever issues are. That's not to negate the fact that we need to be stopping it from ever getting to that level. So the prevention along with intervention.
And just to state what I do know is that a lot of the comments and ideas from the session is actually supposed to find its way up to the Ministry of Health, that to look at it to help in to influence policy. That being said, being a novice, I have one question, and I'm going to direct it at Michael, but if anybody in the room or anybody on the panel would like to answer it, that would be great. Coming from a different industry, just to be honest, seeing the statistics now and understanding the issues we have surrounding childhood mental illness, I had not a clue the level at which it was at. My question is, and this has something that you were talking about, Michael, where politicians or whomever would tell you to whisper it and not say it loud, because it's going to impact financial services, it's going to impact this other area, and then we'll all be worse off if it actually impacts that. Question I have, mental illness at highest levels, has it been identified as truly an issue, or is it just a sidebar? And if it has been identified as an issue, has it been identified as the priority area, or one of those priority areas that we're really going to try and fix? And what's interesting, being a novice and coming in, and I'm hearing two sides, and I'm just wondering if it's a mixture of both or what's actually true. I keep hearing that there's a lack of services, a lack of professionals to deal with it. Then on the other side, I'm hearing that we have all of these resources. It's just that we're not organizing it in the right way to be effective. So I'm going to ask Michael the question. One, has it been identified as an issue at the highest levels? And if it has, is it getting priority, or are we even saying that it should be priority? Two, and then from a resources perspective, do we have the resources? The first thing you need to do, identify you have a problem, regardless what area it is, and then figure out what the solution is and the gap that we currently exist, and then how do we reach there? But do we have the resources, and we just need to organize it to get to the solution? Or is it that we don't have the resources? So, I mean,
let me answer that question.
Yeah.
A year ago, when it was published, the Minister of Health published their 5-year strategic plan. And they gave me a copy of the plan, and I was going through the plan, and it struck me, and I saw, I guess Dr. K brought it up on the screen of the statistics, and it struck me that mental illness was the third leading diagnosis for it. It was like 14. I think in 2010 it was like 14 something, and then it shifted to about 16 something in 2014. So I went to health and I said, how much of this is young people under the age of 18? They didn't know. They rolled all of that up in one figure. So I said, like someone must know this information, because I am seeing high volumes in our system. I'm seeing hundreds of children being diagnosed. So it must be very, very high. But eventually they, I guess, spoke with HSA, and they came back with about 500 children as part of that 1,600 figure. So I started putting my tentacles out in the community, and people started saying, no, it's actually higher than that. We are looking at close to 1,000. So Dr. Lockhart also came in and said, yeah, we're looking at over 1,000 young people that have been diagnosed in this country with a mental illness. Dr. Lockhart has stated, and I agree with him, we have the professionals available in private and public, but there's no coordination. What he is now working on through the Mental Health Commission that he heads up, is he's saying, we now need a facility, and this is where Jen was getting at. We now need a facility to house some of these people so they can start to address the problem. We definitely need an inpatient for young people. We don't have an inpatient for young people, and over the last 3 or 4 years, we have been housing young people who have significant mental illness in the inpatient for adults. And it is a horrible combination, as you guys know. And we've been trying not to. Doesn't mean that they don't exist, we just have no way to put them at this point. But they are there, where it's not just acute, but we are talking about children with serious mental illness. What we are doing right now is that through DCFS, education, and HSA, and Cynical, we are paying out hundreds of thousands of dollars to send children overseas. The monies that we are sending overseas, if we can sit down and say we can purchase those same services and bring it right to this country, we can address more of the youngsters that we have that need just an acute sort of care. No one has sat down and looked at that. I have sent that up to the ministry, I have sat with my folks and I've said, this is a real problem. But again, is it a priority? I don't think, personally, I don't think it's a priority. Because no one is actually taking it seriously. A few months ago, a young lady walked into Burger King with 2 jets and started threatening. I don't know if you guys read that in the media, right? I'm sure everybody saw it. It was in the media and print on the media, on television. Well, we went off, everyone's friends. Oh my gosh, really, you mean people like that? I'm sorry, but we're living a dream where we think that that's not going to start to happen wrong. Because I am seeing it with children. They can't function in regular school. And Susan is my witness, and her and I work very, very close together. These are children that have disrupted entire schools, not just classrooms anymore. They disrupt entire school. When they're not there, the school go into a huge celebration because they're not there. Because we can actually teach children when they're not there. And it's not taken seriously because, as much as I hate to say this, because they're not walking into the school and shooting it up. In America now, they're taking it more seriously because, from the time they see the symptoms, everyone is now on top of that. Because they know the history is that if we don't deal with it, it could mean that you're burying children. We don't take it seriously. The warning signs are there, and what we're doing is we're sending these youngsters off island, and the unfortunate, the unfortunate result is that our children are doing very well overseas, and I'm sure that Ms. Jennifer Bachman is when that transition happens back, their parents can't deal with that because nothing changes in that household. The child has changed, but nothing changes in the household. We're finding it that we're spending hundreds of thousands of dollars, but the child comes back and goes back into the same household. So, to answer your question, is there a problem? Do I think people know that there's a problem? I think that they know that it's a problem. Is it a priority? I don't believe that it's a priority. Because no one has actually died yet. Fortunately for us, even later that walked into Burger King, she didn't hurt anyone. She just got like a 2-year sentence as opposed to giving her the treatment that she needs, and she's certainly not going to get it incarcerated. So in the next year and a half, let's say she's in there for a year, she's paroled or received, whatever, she's back out on the street, and she's not taking her meds again. And she needs long-term care to help her understand what that disorder is. Our children that's dealing with things like that, it's just not a priority. I don't see it being a priority in the country, and it's not going to stop me from actually preaching and trying to get people to understand that we need to give some more attention to this, but it's just not a priority.
It's such a large topic, and I appreciate so many different comments and points of view, and so trying to just speak to maybe just two quick points. One is I heard a recent statistic about 90% of a child's brain is developed by the age of 5, and so we talk about the importance of self-worth as well. The children, and we talk about parenting and the exposure to numbers and words. If they don't have that early, the disadvantage that they're at moving forward can create so many other issues. We talked about just getting to the source of some of the issues, and we talked about parenting, but certainly education is a big part of that, and the disadvantage children are at if they're not getting at a very, very early age that exposure and those opportunities. But the other thing I heard so much was about the importance of connectivity, of organization, of connecting some of these channels. And we're professionals all in our area. It sounds like we need to bring in an expert in logistics. Maybe somebody from FedEx or UPS can help us to understand how to be better connected, because that really sounds like the issue. And the gentleman in the front row talked about leadership and the importance of leadership, and I couldn't agree more, but a comment was made about a top-down approach. And if we're relying only on government, with all due respect to government and the role of government, because I know I have a tremendous respect for what the job is and the heavy hat they wear in the role of government, but we cannot forget, as private organizations, as non-governmental organizations, to assemble and to unite and to be a voice to lobby for what government does, because they are obviously very subjected to the political process, and which changes over time. And so if we're just relying on it to come from the top, I think that's going to be a concern. And so the more we can be logistics experts to organize and assemble some of what needs to be done, the better opportunity we're going to have here for an effect. So,
well, actually, the question perhaps is going to go for Mike and also Susie. It belongs to your big umbrella, the thing that you were trying to talk about. We have also judo organizations here. We have the Scouts, we have Cadet Corps, we have Big Brother, Big Sisters, many others that we are also not using it properly. And we are not coordinated into a big body that is taking any kind of part of me. I'm a Big Brother in Big Brother, Big Sister. I have a little brother, and I haven't matched with him for 6 years apart. It's okay, he's doing good. But sometimes I have a lot of contact with family, but when I try to get contact with the school, for example, or things like that, I always find a barrier. It's really difficult for you to do something more comprehensive. So we are trying to build this comprehensive approach, holistic approach, as they will say in the morning. But it's really, really difficult. We have lots of resources, but you will really notice with your management approach. But it's something that we need to build all together.
One of the things Special Needs Foundation tries to do is be an umbrella foundation that there are a lot of special needs resources on Ireland. Some of there is then the issue of paying for them, but there are a lot of therapists, there's a lot of different services. But parents don't know about them. So what we want to do is be so well known that the minute a parent gets a diagnosis, they can come to us and we can tell them about all the things that are available. And we support the parents and the families, and we provide things ourselves, like parent support groups and newsletters and social activities and education, but also we want to actually we need to give them the information, because there are lots of things out there. But everyone each little company keeps to itself, and they do a lot of things and they don't tell anybody. But so that's why we now have a website where we link with all those other providers. I administrate a Facebook page, and as soon as I know that Chatterbox is running something, I post their stuff onto our Facebook page, so that parents know what's out there. So that's one thing that we try and do, to sort of try and at least bring some of it together and make it easier for parents. But and certainly we're happy to publicise Big Brother Big Sister. I'm in Rotary Central as well, and we always provide funds to Big Brother Big Sister because we know how valuable it is. And I do know, when I used to be at George Hicks, that the school staff then were actually very cohesive with Big Brother Big Sister, and the school council actually arranged for that to be in school because it was in their kids' lunchtime. So I think, again, every school is very, very different and the school staff and the counsellors. Mr. Cadet over there that I've worked with before, each school counsellor on Ireland is very different. Their expertise is very different. Their willingness to get involved with wider issues is very different. Some of them are awesome, and they will do everything they can for families. And certainly, people like Mr. Cadet and Sue Trester, who's just retired, will do anything for organisations like Big Brother Big Sister to make it work.
Can I ask Michael a question? I came across an article, I'm not sure if you're familiar with it, it's the NCD Alliance. It's a good article from reading it, but they were really advocating that children be involved in this. We talk about going to the leadership and letting them form policies and so on, but one of the big things, one of the big pushes was that children be involved in that process. in helping families. And you directly working with especially adolescents. Do you see that visible, and how do you see that playing out here?
The youth department runs a program that's quite good. I think they do a great job in exposing kids to leadership, and once a year I think they do something in LA where they become the folks that actually make policies and debate. So youth parliament, and they have a radio station named Youth Flex, I think it's named, and they do a lot. They do a lot of great work where they are out in the community. Their radio stations are great. They use Radio Came On and they speak about a lot of issues. One of the major things that I've seen in the country is that we don't empower our children enough to speak up, and we are always putting them in a corner, or we're always penalizing them for speaking their mind. And it's one of the things that I've worked heavily on with a lot of parents to try to get them to understand. Your child has an opinion, while they need to be respectful about that opinion, they have an opinion and they have to be able to express that. And it's our job to shape some of how they express that opinion, but they need to be able to talk about it. And we don't do that enough. I'm often called in to speak to a lot of teachers, because many of our teachers also don't understand, because again, 75% of many of our teachers come from another country. So they come into our country and culture, it's quite often it's a culture shock for them. So we are trying to do a better job in the industry of trying to, explain to our teachers how to address some of the challenges. It's important that, to many of our kids, that if you walk past a child and you don't say good morning, they take it as you just don't like them, and they hold that against you. So a lot of this sort of stuff, we are trying to translate a lot of this stuff for our children, for our teachers, for our parents. We don't bring about that awareness enough. We don't see it on TV, we don't see it in print, all right? And we have to be able to do a better job. So again, it's about getting organizations together as well. I believe that there are way too many organizations in this country that offer some of the same things. Because what happens in the country is that government have a very small pot of money, and as a government, we want to be very generous. We don't want to say no. Again, it's driven by politics as well. We don't want to say no. So what happens is that if you have this very small pot of money and it's sprinkled on all hundreds of these very small, finite organizations, while everyone gets something, we don't have enough to actually resolve the issue. So you may get $500, this one gets $500, but you can't actually do anything with that money. And that's why it brings me back to say, we have to do a better job assessing how effective the organization is. Is it following through with their mandates? And if it's not, we have to say to the government, we're no longer going to fund you. We are going to give it to X organization that's following the mandate and actually getting results. Statistics in this country mean almost very little. I was schooled in the US and everything is driven by statistics. It creates our policies. Well, I'm showing them all of the statistical data from DCFS to Feed Our Future to all of these organizations are doing something to help. And I'm saying, here is the statistical data that we now can say, let's shape this policy. We don't take that information, we go a different route. And that's my biggest fear, is that the more we continue to do that don't use the information, we're not going to get, the more ed sites in our system, because as Susie pointed out, all we're going to use them for is to develop reports. We're not going to get, speech and language, because they don't follow the statistical data to say this service is necessary. We know that we have a hell of a mental health issue in this country, yet all the statistics is telling them that. We don't have a pediatric, psychiatrist. We don't have a mental health nurse. We used back in the day, we had a medical social worker. They were that individual was the one that dealt with it from the hospital and translated that information to DCFS. I came up through that regime back in the 90s.
So it's, I think that there's a lot of work to do. Ultimately, it has to be more accountability in the system. And that's where I struggle.
Ms. Kay had her hand up.
I'd like to build on what I'd said before. At the turn of the century, many of you may not remember because you may not have even had any history lessons on this in school, but at the turn of the century, there were millions and millions of children who died worldwide from communicable diseases. In the Cayman Islands, we had lots of children that were lost through communicable diseases. Families, in fact, were very large in those days because they expected to have certain deaths, and I could tell you some stories of that. Worldwide, what happened was it was recognized that these communicable diseases were killing children, and that something had to be done. So all of the big organizations of the world got together and said we must, and some of them were just formed specifically for the purpose of dealing with these communicable diseases. Even the pharmaceuticals got on board because they developed vaccines were developed to prevent them. So now, guess what? We've got to the place where we've got them totally under control. So we're now having a huge issue with non-communicable diseases. And I need to say something before I say non-communicable diseases. After listening to everyone here, we need to call them physical and mental non-communicable diseases, chronic non-communicable diseases. Now that we have so many people that are dying, I don't know how many of you probably may not go to a number of funerals that I go to. I go to a lot of funerals. And I've been, there are a lot I should be going to, but I just got so depressed, I just don't want to go to them. But there are a lot of people in the island that are dying from these communicable diseases, okay? And I think the time has come for us to public health itself is all about prevention. We're preventing the communicable diseases. So what's happened about the prevention part of the non-communicable diseases? Where is that? Where have we reached? The communicable disease preventative, it is well organized. It's got a hierarchy. It's got workers. It's got funds being put into it. It's really well. It's down pat. Now, what about the non-communicable? Have we reached the time now that we need to form a unit? The same health promotion unit, the same public health unit, all working together on preventative health at the ministry level, so that we can actually structure programs that will actually have people specially trained to deal with the non-communicable diseases and to pull in all of the resources together, as I mentioned earlier. Now, WHO just had a huge convention in Switzerland on non-communicable diseases. How many people do you think from the Cayman Islands went? Nobody. Well, actually, I happen to know about 2 or 3 that went, but there were none from HSE. Do you think that now is the time for us to really be looking to see what is WHO doing about it? What are the other organizations doing about it that are concerned about non-communicable disease? And what are we going to do about it? What's the ministry, what's the government, what's the ministry going to do about it? Because until we get, like Dr. Swan said, until we get that leadership, the vision, until we see what's going on up there in the world, what are they doing about it? And until we start buying into the programs, until the political will is there, we can talk and talk and talk, but we'll never get anywhere. So we need again, I have to say, we need a coordinated effort. We need the leadership. We need the structure in place, we need the leadership and a coordinated effort and a team approach to preventative health. Because we're spending millions. I don't know how many. I haven't seen the most recent figures, but we are spending nearly all of our resources in the island is going towards curative treatment. Let's treat. But we need to spend a lot. We need to look at what we're spending on preventative and really push in that direction so that in the next 20 or 30 or 40 years, we're not going to see what we're spending now quadrupling or even, rising on uncontrollable rate.
before I go, we have 5 minutes. So everybody who wants to get something out, think about it in your head, and then I'm going to do quick fire around the room, and of course give the panelists any final thoughts as well.
I completely agree with that, but I think also the community has to understand the need. Because I remember when I was in Youth High School, they did one of their first nutrition drives, and they improved the quality of the food in the canteen. They stopped the children leaving at lunchtime to go down the road to Burger King. We had a huge problem with parents collecting Burger King and throwing it over the fence for their children because the parents didn't get it. And it's like no matter what, and then of course the kids refused to eat the healthy food in the canteen, and they'd be all lining up against the fence waiting for their parents to bag drop them a burger. So the community has to get on board and understand the need as well, because otherwise no matter how much you spend and how much it comes from the top, if the parents and the community aren't supporting it, you've lost.
One, because you haven't spoken yet. 1, 2, 3.
Just to say one thing on that, as a parent, right? My son goes to primary school and they promote healthy eating and all balanced bread gets his food from a balanced meal for his lunch. And then the PTA asks you to contribute stuff after school for them to get their $1 to buy their snack after school, and the snack after school is candy, chips,
honey buns,
sweets, all of those things that you tell me not to bring to him at school, but you want me to give him the $1 so you can sell it to him.
It's a challenge.
Well, this is going back to the mental health, but the cost of the drugs for the EDD children. One of the things that we didn't focus on was the behavioral modification that's so important, and particularly to involve the parents in it, because a lot of the parents don't understand how to handle their children. And before they even go on medication on the very young ones, they institute some of those modifications. A lot of them may either not need medication or need much less. And I think this is an area that we need.
I've just dealt with exactly that. Dr. Hawkins referred a child because she didn't want to medicate. I do in-home support. 5 sessions in the home, there's no issues with that child. Behaviour is absolutely fantastic. School is going well because it was a parenting issue. It was a lack of boundaries. Yes, the child got the belt sometimes, but there was no assertive parenting. I also I've never hit my children, but I was a very assertive parent. There's a difference between not hitting and still being strict. And that child, 5 sessions, no need for medication whatsoever.
So I think there's a big need for that group, you know, the young ones, 2-3-year-olds.
Another thing too, with the coordination, which Ms. Anke talked to, I know this last couple months you had to stand up to bullying and all that kind of stuff. But yes, you take on these issues to say, all right, you need proper nutrition, but then you don't think about all the factors that impacts the child's nutrition. You say, yes, school, then I have issues with after school. You don't talk about supermarkets providing healthy snacks, etc. Another thing too is that you're talking about bullying. And yeah, you go in and say, yeah, but what if a child needs counseling because they're being bullied? Right? My child was bullied and is continually, because of her issues, sometimes she's targeted, but then to get the support services to help her deal with the issues, the mental health issues, there's nothing there. So the ministry or government takes on these issues, but then there's no support behind providing these you're talking about nutrition, there's no support behind it, you don't get all the stakeholders' inputs and buy into it. You're talking about bullying now, but you don't deal with all the factors and things that can help and assist the child or whoever. And then next year you're probably going to do something else, and then, yeah, it's a hot topic, we're going to deal with it, but I'm tired of you coming in, we're a reactive ministry. The government is a very reactive one, and you don't do anything to really think about it, get these stakeholders involved and say, how can we prevent this from happening? Can we look at all the scenarios, do our SWOT analysis, like you do in business and tourism and stuff like that. We need to do that for our children and whatever issues that they face, and then actually do something about it, put some action in place. Not every parent is going to be like us in here who are educated and willing to say, look here, I'm not accepting what you're saying, let me go find a solution. There are lots of parents out there that when you talk to them, they don't even know some of the services that's offered on island. So if they come across one barrier, they accept that. They can't go and say, all right, let me go somewhere else. They just accept everything as gospel and don't realize that there's a lot of different resources that they can access. So since this is being recorded and this is going to the ministry, that is my take on the situation.
I guess I'm following on a few people. I was quite thankful for that history lesson. I was wondering which century you meant actually, because I don't know too long. Yeah, the communicable diseases are more dramatic to begin with. You're going to drop dead from smallpox or whatever, all those things. So the non-communicable can stay there and simmer in your body even though it's going on. If you have the mental health issues, that can be going on for years and no one really knows it. But if you have enough people in place, they can pick it up. From a school point of view, the more prevention you do, the better. The more counselors you have and the more available you are to students, the more they actually come to see you. So I think this whole business of how many educational psychologists you have so that you don't have a mile-long list of assessments to do, how many counselors you have in the school, how many psychologists that actually do more in-depth therapy down at HSA that you have, how many psychiatrists you have, can never be static because we're in a rapidly changing society. That itself, with all the stresses and the pace of life and the lack of parent involvement, that generates an environment where I think, in my opinion, mental health issues tend to come actually more to the surface. So we need to bear in mind the people that provide and pay for these services have to bear in mind that you can't say we're going to provide 5 counselors for the island this year and that's fine, because by the time the 5 years are up, the population has grown. More people realize they actually need these services to begin with, and more problems have actually come up. So it can never really be static. There's planning that needs to be going into place, but I think there needs to be a sort of a change in the way we look at it, and that we can never really say that we have enough really, because the more you have, the more people realize the need. And that is actually a good thing, because the more prevention you can have. I was thinking today when we were talking about mental health and taking away the stigma, every one of us in this room needs some mental health intervention, okay? It might be a little bit, which means that you read a self-help book and you don't totally melt down when you lose your job because you've done that much. You talk to a friend for something else, you talk to a counselor for something else, a therapist for something else, you might need to go to a psychiatrist and get some medication. So there's such a range there, and it's always a need. We all need it. Let's take away the stigma. Let's realize that we provide, just like doctors, nurses, we just need to provide services, and can't say have enough, because it's a little different from the smallpox, measles, mumps, eradicated. It's not something that I can see eradicated anytime soon, especially from mental health point of view.
Any last comments from the crowd? No. I'm going to give the panelists a last chance if there's anything. Yes.
I think this should be a precursor to a bigger meeting with children. I was thinking have something like Summit of the Children, which all these issues are discussed. We look at the issues, we look at the solutions, just do a SWOT analysis, etc. I think we should have a Summit of the Children. But Tillman is such a small place, everything affects all of us, you know. It's a tight-knit community and it's small and everything affects everyone.
Just following on that, just to say that the Ministry of Community Affairs is going to be working in regards to the whole continuum of care for children. And what we stress to them is it has to involve all ministries, because it's not just one issue, it's many issues. And the second point real quickly is we have done a number of studies over the years. The last major one we did was the risk and vulnerabilities assessment back in 2006, in which we brought kids in. We had children as part of that whole forum. They were surveyed, they had input, they made it clear what their needs were. But again, it's one of those things that was done and put on the shelf. The information was all there. And when that happens time and time again, unfortunately, people lose faith and the children suffer. So we cannot back off of this. It has to, the momentum has to be there, and we have to be addressing non-communicable diseases across the board, whether it is diabetes, whether it is cardiovascular health, whether it is mental health. Because the point that somebody raised, Dr. Yin and her team came and met with us at Children and Family Services years ago when they were working to develop that project about changing school lunches to reduce the level of childhood obesity. And they were doing a lot of public education. But the slam of pain, parents, when they introduce healthy meals in school to improve childhood health, the parents revolt it. And that does not help. So it's the whole education process has to start from ground level on all these issues. If not, it's not going to work.
So, somebody who's there?
Well, I was just listening, and there were some wonderful suggestions that have been made here and getting into the community, targeting parents, which are good, because you know that at the end of the day, the children go home, and then the home and the parents and what help to mold a society and children. But I was looking at, okay, who from here or who's going to come up with a timeline with all these suggestions and wonderful things that we came up with from here. Where is the project management in it? We have all these suggestions. We want to get all the organizations together. Are we going to say, okay, by 6 months, who is going to come up and say, this is the result? We have gone to ABC Association, the non-profitable, the profitable, then the government. This is the response. These are who responded to us. These are their suggestions. And then who's going to pull that together and say, okay, let us move on from here then. Who wants to come on board? Who didn't even want to come on board? And then even publicize it so that you are now confronted directly with the issues, and we highlight it, and then we see, okay, let us now get together. And those who didn't respond, how can we go back to them and get them on board? And also going into the communities, as you said, to have the parents, you have health centers. So who are going to target those who come to the health centers, those parents then who can't afford it? Can we get the pamphlet out to them? Can we go to the PTA, get the parents involved? Because maybe the stigma is there, even with mental health. A family may feel ashamed, oh, my child has a mental health issue, I don't want to highlight it, I don't want to bring it up because I feel ashamed, or am I the one who caused my child to become like this, so I feel guilt. So then who is going to help me deal with that to then help my child, right? So it's like a double-fold effect, but good. So we could just streamline it, see what we can do in a timeline, and then look at where we are, look at how we can review the result from that result, and then go back to the drawing board. That is my take.
There's a little invisible person behind the camera who's going to put it all together. Not you, I'm talking about who's going to be viewing the film. Is what I need to understand that it's supposed to go up to the ministry. However, being in government before, I've seen a lot of sessions like this in a different context, where you talk about it, you identify the issues, you identify the solutions, and then nothing happens. To Michael's point, until there's accountability and somebody at the highest level, you actually say, guess what? We have the statistics here, and in 3 years, your job is to make sure every time we go along and we do the statistics, but in 3 years, it needs to be reduced by 10%.
Right.
Until you have that and somebody knows that your job is on the line at the highest levels, you won't get the impetus to actually get it done. It's just where I'm actually seeing things get done and where things don't actually get done. What's interesting, and there may be a correlation or not, because I'm not exactly sure how well the rest of the Caribbean is doing it. When I actually look at our government officials, and even within, not to slight anybody within the Ministry of Health, it's interesting that I don't see a lot of doctors as politicians or as persons actually at the head and having to meet with Caribbean governments and ministers of health and persons within the Ministry of Health. It's just interesting that for the first time you're actually meeting with persons who are doctors. And now, if the actual end goal is that your system is no better than ours, then it doesn't matter. But it's just a stark difference in seeing how our system is set up. And virtually, I can't think off the top of my head of any Caribbean government that I've met with in their Ministry of Health at the highest levels that the persons aren't doctors or the deputy chief officer isn't a doctor, and even the ministers all seem to be actual physicians or doctors as well. And that's just an interesting tidbit I'll throw out there, and I don't know if that's part of the issue or not. But we can talk about it quietly, and I think we've been doing that. You see the results. What happens is you need to start talking about it more aggressively and in channels that politicians don't like. And when there's an issue and it's splashed on the front page, then you get solutions. I'm not saying that we should do that, but just throwing it out there that seems to be what works in our context.
It's on tape.
Yes, they can no longer fire me, right? But I just want to see if any of the panelists have anything else that they'd like to throw out there quickly before we...
One closing thing I'd like to say is that if we think that we have mental health issues now, we're going to have greater mental health issues in the young population. In the US, they're finding millions and millions of children are addicted to media. And I could list you 50 media sources right now. From video gaming to just watching movies to playing music constantly to Facebooking, FaceTiming, Twitter. What is happening is the children are in a 2D environment. It's the computer and it's them. And they're losing a lot that they would gain in a 3D environment. They're losing their social skills. They're losing their ability to communicate. They don't have a self-esteem. When you win a game, a video game, it is a fake thing. It isn't real. You have not achieved anything in life. You have not done anything that's going to enhance your life. You've just won a game, but what is the game? The game is nothing. And so these children will not have good self-esteem, and they're going to be more irritable. This is the findings that have come out. If you all are interested, you can go to the internet and on Google, Media on the Brain by Scott Ritzmer. He has done in-depth studies because he was addicted to media himself, and he got himself out of it, started researching to see what's going on in the US, and he's really, it's a DVD series, it's lasts 7 hours, but he has a trailer on the internet, Media on the Brain. And I hope that we can get ahead of that. I hope that we can, so through my clinic, I educate every single parent that comes to me, because I see them, they come into my office, and I wouldn't tell you what it's like. The babies are being given the phone with all sorts of things on it. And the children have got the games. And some children come in and they don't look at me once. They don't acknowledge me at all. And they're focused. And parents believe that that's the best way to control the child. And
when a baby lays on a mat and the playthings with the dangly slot, they're called, there's now one of those that has an iPad slot. So that when your baby is not even sitting up yet, it can be looking at the iPad. You can stick a movie on and it will be entertained.
Anybody else on the panel?
I'd just like to say, I think sort of on a positive note, because otherwise this is really depressing. A few years ago, there was none of this. There were no collaborative efforts for healthcare that I saw. There were no meetings of mine. Last year was 500 participants, and they had direct information that wellness in the workplace had positive effects, and that people say that they're still sustaining some of those things. This is now, we're up to 800 registered participants. It's open to the public. It's free. People are here and they're talking. I think that's incredibly hopeful for a country that didn't, 5 years ago, I didn't see this. 3 years ago, I didn't see this. So I think that we talk about not making any movement and all the things we have to do, but we are doing it. And this is, I mean, they're tiny baby steps sometimes, and they're not fast enough, and kids are slipping through the cracks, and they're not getting the help they need, or workloads are, like, this is a huge step. So it's something, at least something.
I agree with Jennifer. I think we are moving, not as quickly as I would hope, because I am in the trenches every day, and I see the awful impacts of when we're not moving quickly. And, you know, before, we'd see young people at 15, 16 years old when I was a social worker or when I worked in children's homes. Today I'm seeing kids 3 and 4 years old, 5 and 6 years old, and the age range is getting younger and younger, with children displaying very, very challenging behavior or being diagnosed very early. And of course, that contributes to our crime problem later on. So my input has always been, until we can get folks at the highest level to acknowledge that we have this problem, and it's not just coming to a seminar and talking about it, and then feeling comfortable and check that box and see you next year, same time, same place. Nothing is going to change. And I'm not being pessimistic, because I do this for a living every day, and I do it with a smile. I don't break my teeth. I love what I do, and I just want everyone to understand that. I talk very seriously about the issues that are on, but I bounce into work every single day, but almost the last person to leave there, because I love what I do. I don't see me doing anything else, and I help everyone that I possibly can. Because for me, it's a rewarding feeling knowing that I can help one of my citizens, that at the end of the day, that gives me greater feeling than just getting a paycheck. Because I know that I have 2 daughters that have serious mental illness, that ultimately if I no longer existed, I would expect that someone in this planet would help them along. So I do this as a citizen. But first and foremost, I do this as a citizen first. And I just want to encourage everyone, we have to stop looking at it as a job now. Because Cayman that I grew up, we were about community. It was a pride thing. We were about helping one another. We've lost some of that, and I'm hoping that along the way, we try to get some of that back and not rely so heavily on government to bring that together. We still need our political leaders to do their jobs and admit that this is what it is, but it all isn't lost. So I leave you with, I'm here to help. I'm here to certainly communicate. Please give me a call. I'd like to chat with you afterwards, because if you're having a challenging time getting into the school, please give me a call. This is what I do. Please give me a call if you're having some issues in getting the support that you need for your children. I'm on that, because I don't want people to walk away knowing that I am here, and at the end of the day, you were talking to someone and I didn't offer. I didn't come through for you. I want us to be able to work together, and it is challenging, I would say to you, but we can all make that difference. So thank you again. This has been always inspirational for me to get in a room with a lot of folks who truly care, who want to make a difference. I can walk out through that door, hold my head high, and get back and get my job done.
2 things. Just want to make it clear to the government and as a pediatrician that provision of healthcare and a child's access to healthcare is a human right. Like many other human rights, sometimes we have to fight for it. And of course, we then have to be the advocates in terms of that. And secondly, I don't think any government can argue that money and resources invested in health obviously is going to impact productivity. And we may not see necessarily immediate financial returns, but down the road, then there obviously is going to be savings, and I don't think anyone can then argue.
Just one thing that, as an educational psychologist who's worked in UK and here, one of the overriding issues that, if this is being recorded, seems to be the health education. Who's going to pay for this? And they always say it's the other person. So whether it's autism, whether it's ADHD being called a learning difficulty, they always want to say it's the other department that has to do it. And what they need to remember is the community is going to pay for this. It's going to, it's going to come out of government funds. Just get yourselves together and talk to each other. And even if you split it 50-50, you still have to pay for it. Don't try and always say it's the other person, because then nothing happens. And then as the Special Needs Foundation, Michael sort of says, he's passionate about what he does and he's there to support people in the public school system. We're there to help parents. Please, pick up a leaflet from our booth, contact us, look on the website. We do a lot of things for parents and families, and we want to help bring a lot of these things together. So, we are there, and we're trying to be bigger and better to help parents and families out.
I think just listening to comments, I'm obviously someone that's not from this community, but we've had to deal with similar issues in the US where I'm working, and I'm a part of the US as well. Clearly there's an issue with leadership. Everybody's saying somebody else should do this, but nobody's stepping up to the plate and saying, I'm going to do it. And there needs to be a strength of leadership. It's probably not best to come from the government. They're just too busy with other things. The government can sanction and authorize things, but ultimately it's going to take a private person to step up and say, I will do this. The next thing you need is money. And the best place to, this is something that we've been particularly good at in the US with what I do, because for adolescents at least, industry does, at least insurance does not pay for obesity management at all whatsoever. They'll pay for it up to the age of 18. But if you've got breast cancer and you're 16, they're not going to say, oh, you're too young. They'll treat it. But when it comes to obesity, they won't touch it until they're 20. So what we did is we went to industry. And, if Burger King's going to be next to the school, why can the government not legislate that a portion of their funding should go toward the preventative side of things? And then the government can earmark where those funds should go. So I think that in a democratic country, the government can decide where the priority should lie. And if it is childhood mental health, then you need an autocratic citizen to step up and make it happen and partner with industry, either by legislation or by voluntary giving of money, to create that infrastructure and that money that can then build that mental health home, that can develop that grassroots campaign. Maybe every time Burger King has an advertisement on TV, 1 in 10 advertisements should be a community-based advertisement. That's not that difficult to do. And it doesn't cost the government any money to do that, they just need to have that legislation.
And I'm going to wrap it up by saying you actually said something that I was going to end with, in that, however, in order for government to legislate, they need to see it as a priority. And in order for them to see it as a priority, the onus is on everybody in this room to stop whispering and start screaming so that they can hear, and that it becomes a priority. And when it becomes a priority, and the government then needs the help of everybody around this room, it's one thing to sit here and say, here are the issues. But when they say we need help from this private sector entity or that private sector entity, then we need to step forward and give that help in order to get it done. Because failure isn't an option, right? Because the Cayman I grew up in, it's long gone. When I remember when I was 7, 8, 9, 10, seeing Cayman today, I'm scared what my 4-year-old and 14-month-year-old will see when they're 8, 9, and 10. So the onus is also on us to help to make that policy what it needs to be, but then to step up to help better Cayman. So with that, I thank you all for sitting and listening, and we're going to definitely now make sure that tape gets in the right hands and we can formulate and see some possible movement in the future. Thank you all.